Mastering Gait Belts, a step-by-step guide to safely and securely using a gait belt. Today, we're going to talk about a very important tool in caregiving for someone with ALS, the gait belt. The gait belt is a safety device designed to help you provide support and stability to your loved one when assisting them with standing, walking, or transferring from one position to another. It's especially useful as ALS progresses and mobility becomes more challenging. Let's break down using one step-by-step. First, let's review the parts of the gait belt. The most commonly issued type of gait belt is made of a cloth material and has a tooth and receptacle style metal buckle. This style of buckle seems tricky initially, but is easy to use with practice. Identify the hinge portion of the buckle and open it. Feed the end of the belt through the open hinge and bring the fabric up over the teeth and down through the opening on the non-hinge side of the buckle. Continue feeding fabric through until you reach the desired size. You should be able to apply pressure to the belt without the buckle moving if executed properly. There are also gait belts with a large standard clip-style buckle, but take note that these are not as easily adjustable in size. Now that we are familiar with the parts of the gait belt, let's try applying one to a loved one. First, locate their natural waist. However, avoid positioning it over sensitive areas, medical devices, or tubing. Wrap the belt around the waist. Now, locate the hinge tooth opening and feed the end of the belt up through it. Pull the fabric up over the teeth and through the opening on the non-hinge side. Keep repeating this process until you reach the appropriate tightness. Ensure it's snug but not constricting. The snugness provides a secure grip for you without causing discomfort to your loved one. Check to make sure it's secure. You should be able to grab up underneath the belt with a flat hand without it slipping. Center the belt buckle and tuck any extra tail into the loop of the belt. If you are performing a transfer where your loved one stands up, you may need to readjust the size of the gait belt once they are standing. This is because once they are standing, it may be too loose. If this occurs, loosen the tail, pull back through the loop to the desired tightness, then retuck the tail. Once they are reseated in a secure position, you can remove the gait belt by pulling the tail of the belt back through the buckle in reverse. It's essential throughout this process to maintain constant communication with your loved one. Check in with your loved one. Ask them how it feels and if there's any discomfort or adjustments needed. Remember, the gait belt is there to aid in safe mobility, so their comfort and safety are the top priorities. Your confidence and reassurance can make a big difference in how safe and secure they feel using a gait belt. Mastering gait belt technique not only ensures safety, but also promotes dignity and comfort for those we care for. Learn more about this and other techniques on knowals.com. Thank you for watching.